Senator from Minnesota.
Mr. President, I thank my colleagues, both colleagues from Connecticut, and as Senator Murphy just said, a budget is a moral statement, and how you handle the needs of your constituents in the end has got to be something that you feel in your heart. And what we are saying today is that our constituents' health care, it's not something you can just bargain away over the summer and cut trillions of dollars from Medicaid or Medicare or the Affordable Care Act and think it's all going to be okay. As our colleagues are learning, it's not okay. And I start with the kitchen table. That's where people see their bills, and that's where right now they're seeing their grocery bills. And for millions of Americans right now, they don't even know if they're going to be able to get groceries for their kids. And that is because what's been happening, not just with the health care premiums, but also with those millions of Americans, those families, those veterans, those seniors, people with disabilities and their families that use SNAP. A lot of people might not have known how important this is to these families. Well, when you go to grocery stores in rural America and you talk to the small-town grocers, you find out just how many people at various points of their life, maybe they are working several jobs, maybe they went through a divorce and they don't have enough money to be able to get their groceries. Maybe it's a family that struggles and their child has disabilities and can't work. These stories are all across our country right now. So that is why it is so callous that the administration, when they know they can transfer funds from anywhere to pay for SNAP, has decided that they're going to take on this fight. So why not give trillions of dollars to wealthy people and then tell people they're not going to be able to get their groceries? First they said, well, we're not going to do it. Then the court stepped in, Rhode Island, Massachusetts, said, yeah, you are going to do it. The law says you have to, at the very least, use this contingency fund for $5 billion that's sitting there. And now you're not going to use it for a golden bathroom in the White House, and you're not going to use it for a ballroom, and you're not going to use it for anything else that you think is your vanity project of the day. You're going to use it to help people afford food. That order came out. They also said, and guess what? You can also transfer funds from other places to be able to help pay for people's SNAP and their groceries. Administration first says, yes, we will comply with the order. The USDA Secretary of Agriculture, says yes. And then the next thing you know, we suddenly find out, no, we're just going to pay for half of stuff. We're going to pay for half of stuff. Now we're going to tell some states it's okay, some states it's not. We're going to mess around. Then what happens today, in the middle of the day, then the president sends out a statement, an official statement on his platform of choice, Truth Social, and says, oh, we're not going to pay SNAP benefits. Sorry, signs it, Donald J. Trump. It's right there. Anyone can see it. Then today, the press secretary says, no. We are going to pay the SNAP benefits. This will eventually be resolved in court just this week, an emergency order. My very strong belief is the court is going to say, none of this, you're following the court orders, you're going to provide the SNAP benefits. But think about those families looking at the bills, and think about the families looking at the health care bills, which is what we're here about today. Basically, what we're seeing here is people are standing on a health care cliff. 4 days into the health insurance marketplace open enrollment period across America, whether it's blue states, red states, we happen to know that 75% of the people on these Affordable Care Act policies live in states that Donald Trump won. Why? Well, a lot of small companies, a lot of rural areas, 27% of farmers and ranchers are on Affordable Care Act plans. If you work at a big corporation in a big city, you're going to have health care. They're going to provide it to you. If you work at a government entity, whether it's local, whether it's state, whether it's federal, you're going to have health care. But if you're an entrepreneur and start your own small business, like the woman I met with in Eagan, Minnesota on Friday, who has one employee that she loves, who had cancer, she pays 75% of his premiums for him and his wife. he pays 25%, and you barely making it go right now, you know, tariffs, all this stuff going on, then you think, can I even keep this employee? Or can I keep the employee, but then they won't have health care insurance, and they made it through cancer, and I love this employee, and I want to keep him on. Those are decisions Americans are making right now as they see these premiums double across the country. It's across every single state. Texas, 60-year-old Texas couple, for example, earning about $80,000 a year, could see their premium increase by more than $17,000. I was just on a call with some Nebraskans. They're going to see doubling, tripling of their health insurance premiums. We have heard time and time again, Senator Murphy just mentioned Florida, but whether you're talking to people in Idaho or Utah, whether you are talking to people in the rural areas of West Virginia, they're seeing the same thing, doubling, tripling of their premiums. And it is within our grasp to do something about it. This amount of money for a year of it, and you can double that to 2 years, is literally nearly the same amount of money as the president gave to Argentina. How can that even be possible that we as a country think that it's better for our country to give $20 billion to Argentina than it is to help this small business owner be able to afford her employees' health insurance? How could we even in our wildest dreams decide that is a priority, or the priority is a gilded bathroom in the White House? This is happening all over this country. It is time for our House colleagues to come back after their 6-week vacation. It is time for our Senate Republican colleagues to sit down and negotiate with us, because this is not a December thing. This is not a January thing. This is a now thing. It's happening now. Thank you, Mr. President. I yield the floor.